Mrs. Thompson, how are you today? Picking up a prescription for Seth? All right. And if you could just verify his date of birth for me. Excellent. And the current address, please? All right. I see this is a new medication. Would it be possible for me to have a moment or two of your time to go over some of the information about this new medication? Thank you. Just to make sure we have the correct info on file, does Seth have any drug allergies? No? Okay. And how about any other medications that he's taking? All right. Any over-the-counter medications? Okay. And is he still taking the Dimetap? Alrighty then. And since the last time he's come in, has he been diagnosed with any other diseases or conditions that you want us to have on file? Alright, thank you so much. So before I tell you about the medication, could you tell me what the doctor told you about it? Okay, that's correct. This medication is a liquid medication. It's called Zithromax or azithromycin. And the strength that we're going to be giving Seth is 200 milligrams in 5 mLs. So it is a suspension, and it's used as an antibiotic that's going to help clear up his ear infection. Alright, so Seth's going to be taking this medication for 5 days. On the first day, he's going to take a 5 milliliter dose, and we'll enclose a dropper in there so you'll be able to give him the exact amount. And then on days 2, 3, 4, and 5, he's going to be taking 2.5 milliliters. And that's going to be taken once a day. So the total is going to be 15 milliliters. So you are going to finish the whole bottle that we dispense to you. Alright, so you want to make sure before you give him the medication that you shake it well. And then you're going to draw up the correct amount in the syringe that we enclose. And then he's going to take it by mouth. Alright. It can be stored at room temperature. Some of them need to go in the fridge, but this is not one of those medications. So you can store this one at room temperature. Alright. The other things that I'd like you to be aware of if Seth starts to complain, some of the common side effects are a belly ache, an upset stomach, and you might notice that he has some diarrhea. If you happen to miss a dose, so you forget to give it to him in the morning, it's okay to give it to him that same day. The big thing we want to be careful of is making sure that we don't double any doses. So you never want to give him on days 2, 3, 4, or 5 more than those 2.5 mLs in a day. Alright, there are no refills on this prescription. It's just going to be the 5 days that he's taking this. Alright, so could you just tell me again how frequently he's going to be taking the medication? Excellent, and how many days is this prescription for? Perfect, thank you so much. Alright, so once again, just make sure that he's taking it once a day. And then he uses the 5 ml dose the first day, and then 2.5 mLs the other days. If you have any questions or any concerns, you can reach me here at the pharmacy. Excellent. Thank you so much for your time, and I hope that Seth feels better. Have a great afternoon.